Hello friends. Welcome to Ultimate Health Guide. In today's video, we're unraveling the complexities of addiction. We'll break down the essence of addiction using the 4 C's framework: craving, compulsion, control, and consequences. We'll also explore the primary types of addiction, including both substance and behavioral addictions, along with their subtypes and symptoms. Stay with us and don't forget to subscribe for more in-depth health insights. Let's get started. What is addiction? Addiction is a chronic condition marked by an uncontrollable dependence on a substance or behavior, despite knowing its harmful consequences. It's as if the brain's reward system becomes hijacked, making it difficult to resist cravings and compulsive actions. Normally, this system helps us experience pleasure and motivate us, but in addiction, it becomes overactive. This leads to significant changes in brain chemistry, particularly how dopamine, the neurotransmitter associated with pleasure, is processed. These changes create a powerful urge for the addictive substance or behavior, making it challenging to break free from the cycle. Is addiction a disease? A critical question in understanding addiction is whether it's considered a disease. Many experts, including those from organizations like the American Medical Association and the National Institute on Drug Abuse, classify addiction as a disease. This classification is based on the fact that addiction involves changes to brain structure and function, similar to other chronic diseases. As a disease, addiction is characterized by persistent, compulsive behavior and brain alterations that drive individuals to continue using substances or engaging in behaviors despite the negative consequences. Just like diseases such as diabetes or heart disease, addiction requires ongoing management and can impact various aspects of life. Recognizing addiction as a disease helps reduce stigma and promotes a better understanding of its complexity, encouraging individuals to seek help and support. Symptoms of addiction. The symptoms of addiction can be understood through the 4 C's framework: craving, compulsion, control, and consequences. Craving manifests as intense and persistent urges to engage in the addictive behavior or use the substance, often leading to a preoccupation with obtaining and using it. Compulsion involves repetitive and ritualistic actions, such as compulsively gambling or checking devices, even when the individual recognizes the risks. Control issues are characterized by a noticeable loss of control, such as drinking more than intended or continuing harmful behaviors despite serious consequences. Consequences encompass the adverse effects, including withdrawal symptoms like shaking or nausea, psychological impacts like anxiety and depression, social withdrawal from friends and family, and financial troubles due to the costs associated with the addiction. Why does addiction happen? Addiction doesn't arise from a single cause. Instead, it results from a complex interplay of genetic, environmental, and psychological factors. Genetics can play a crucial role. If addiction is prevalent in your family, you might have a higher risk. However, genetics alone are not determinative. Environmental factors are also significant. For instance, growing up in an environment where substance use is normalized or experiencing high levels of stress can increase the likelihood of developing an addiction. Psychological factors are equally important. Individuals who face trauma, mental health issues like anxiety or depression, or use substances to cope with emotional pain are at a greater risk for addiction. These various factors interact in intricate ways, increasing an individual's susceptibility to addiction. What are the effects of addiction? Addiction has widespread effects that can impact physical health, mental well-being, social relationships, and financial stability. Physically, addiction can lead to severe health issues. For example, chronic alcohol abuse can cause liver cirrhosis, while opioid addiction might result in respiratory issues and a heightened risk of overdose. Psychologically, addiction can lead to persistent anxiety, depression, and cognitive impairments. The relentless cycle of craving and use can contribute to mood swings, paranoia, and impaired cognitive functions. Socially, addiction often causes strained relationships, social isolation, and disruptions in work life. The personal relationships that suffer due to addiction can lead to emotional distress and social withdrawal. Economically, addiction can be financially crippling. The ongoing cost of maintaining an addiction, combined with potential job loss or decreased productivity, can result in significant financial problems. Individuals may face mounting debt, loss of assets, and economic instability as a result of their addiction. If you're finding this video helpful and informative, please give it a thumbs up and subscribe to Ultimate Health Guide. By subscribing and hitting the bell icon, you'll stay updated with our latest content on health and wellness. Types of addiction. Addiction can be categorized into 2 primary types: substance addiction and behavioral addiction. Let's delve into these categories with more detail. Substance addiction. Substance addiction involves dependence on specific chemicals or drugs. This category includes alcohol addiction. Alcohol addiction, also known as alcoholism, is characterized by an uncontrollable urge to consume alcohol despite its harmful effects. Chronic alcohol consumption can lead to severe health problems such as liver disease, cardiovascular issues, and mental health disorders. Symptoms of alcohol addiction include frequent cravings, difficulty cutting down on drinking, and withdrawal symptoms such as shaking or sweating when not consuming alcohol. Opioid addiction. Opioid addiction encompasses dependence on prescription painkillers like oxycodone or illicit substances like heroin. This addiction is marked by intense cravings and severe withdrawal symptoms, such as nausea, muscle pain, and flu-like symptoms. Long-term opioid use can cause serious health issues, including respiratory depression and increased risk of overdose. Symptoms include a persistent need to use opioids, difficulties in social or work environments due to drug use, and withdrawal symptoms. Stimulant addiction. Stimulant addiction involves the use of drugs such as cocaine or methamphetamine that increase alertness and energy levels. While these substances might offer short-term euphoria, their long-term use can result in severe health issues like cardiovascular problems and psychosis. Symptoms of stimulant addiction include extreme mood swings, increased heart rate, paranoia, and erratic behavior. Cannabis addiction. Cannabis addiction, while often debated, can lead to dependence in some individuals. Regular use of cannabis can impair cognitive function, reduce motivation, and cause mental health issues such as anxiety or depression. Symptoms include a strong desire to use cannabis, difficulty controlling use, and withdrawal symptoms such as irritability and disrupted sleep patterns. Behavioral addiction. Behavioral addiction involves compulsive engagement in specific activities rather than substance use. This category includes gambling addiction. Gambling addiction is characterized by an uncontrollable urge to gamble, often leading to significant financial losses and personal distress. Compulsive gamblers may experience severe emotional and legal consequences, including strained relationships and job loss. Symptoms include a preoccupation with gambling, wagering increasingly larger amounts of money to achieve excitement, and using gambling as a means of escaping problems. Internet and gaming addiction. Excessive use of digital platforms or gaming can lead to various issues, such as social isolation, decreased productivity, and interference with daily responsibilities. Overuse can also cause physical health problems like eye strain and poor posture. Symptoms include spending excessive amounts of time online or gaming, neglecting personal and professional responsibilities, and experiencing withdrawal symptoms when not engaged in these activities. Pornography and masturbation addiction. Addiction to pornography and compulsive masturbation can negatively impact personal relationships and mental health. These behaviors may lead to decreased sexual satisfaction, relationship issues, and disruption in daily functioning. Symptoms include spending excessive time viewing pornography or engaging in masturbation, feeling a lack of control over these behaviors, and experiencing distress or problems in personal relationships. To summarize, addiction is a multifaceted condition with a range of types and effects. We've examined both substance and behavioral addictions, detailing their various forms and impacts. In our next video, we'll explore strategies for managing and overcoming addiction, discussing various approaches and tools that can assist individuals in their journey toward recovery. If you found this video valuable, please like, subscribe to Ultimate Health Guide, and stay tuned for more content. Thank you for watching, and we look forward to seeing you in our next video.